Hello, everybody. We're going to get started with our rounds for May the 6th. Sorry, I had to stop and look at the calendar. We're very lucky today to have Caitlin and Sam with us again, and they're going to speak on harm reduction, and I'll let them introduce themselves.
Caitlin, do you want to go first?
Sure. Good afternoon, everyone. My name is Caitlin Dobrads. My pronouns are she and her, and I'm a very, very newly hired community health promoter at the North Bay Prairie Sound District Health Unit. So I've been just in the position for a few weeks now, started on April 11th, and I come with a harm reduction background working previous to this position at the AIDS Committee in North Bay. So I've been doing harm reduction work for, gosh, about seven years now. So definitely really fortunate to be here today chatting with folks, and very happy to have everyone here. Thank you.
Thanks everybody for joining today. So my name is Sam Doherty. I'm a community health promoter with the health unit as well. I'm based out of our Parry Sound office. One of the portfolios I work in is enhanced harm reduction. And I'm going to get started here. Before we get started, I just want to begin by acknowledging that we're hosting today's meeting on land that has been inhabited by Indigenous peoples since time immemorial. The North Bay Prairie Sound District Health Unit sits on the traditional territory of the Anishinaabe peoples and within the lands that are protected by the Robinson-Huron Treaty of 1850. We'd like to acknowledge nearby territories of the Wasauksing, Shawanaga, Magnetawan, Doquis, and Henby Inlet First Nations, and acknowledge that we're also situated on unceded territory of the Algonquin Nation and settlement of the Métis Nation. As individuals and as an organization, we're dedicated to honoring Indigenous history and culture and committed to moving forward in the spirit of reconciliation, respect with all First Nation, Métis, and Inuit peoples. So I'm just going to share my screen. It worked when we tested it, so I'm just give me one quick second here. There we go. Sorry about that. So today, I'll just Caitlin, I'll just continue on with these couple slides here. But today we're here to talk about approaches to addressing the spectrum of substance use, specifically with a harm reduction focus. So thanks again, everybody, for joining us. Before we get started, we just wanted to let folks know that, of course, we're, as we mentioned, employees of the North Bay Prairie Sound District Health Unit, but have not received any financial or in-kind support for this presentation today. So sorry, got distracted myself. Our agenda for this afternoon is we're just going to go through a little bit of local context. We're going to talk about that comprehensive approach to addressing the spectrum of substance use. We're going to really focus in on harm reduction, and then we're going to talk just really briefly about a couple of local resources to wrap things up for today. All right, I will just jump right in with some of those local context pieces. This information, depending on if you've sat in on some of the other presentations that Caitlin and I have provided, this may be familiar information, but for folks who are maybe new to our topic, we just wanted to share some information about the number of opioid-related deaths that we've seen in the Nipissing Parry Sound districts. So this encompasses our whole health unit region, but we've really seen a drastic increase in the number of opioid-related deaths over the last few years. So in the top here, you can see that in 2019, there was 19 opioid-related deaths. And then in 2020, which is currently the last full year of data that we have, the number of opioid-related deaths more than doubled. So it was 51 in 2020 in terms of the number of deaths. And though we don't, as I mentioned, don't have the full year's worth of data for 2021, we do expect the numbers to be quite similar to 2020 based on the preliminary data that we've received so far. In line with this, we've seen, especially during COVID, a drastic increase in the number of opioid-related deaths. So here you can see the pre-pandemic cohort, which was calculated as March to December of 2019. Our health unit region had the 11th highest opioid-related death rate of 10.8 per 100,000, compared to 7.9 per 100,000 in all of Ontario. And then as we moved into the pandemic, so the pandemic cohort being the same time period in 2020, we jumped to be the fourth highest, to have the fourth highest opioid-related death rate in Ontario. Our rate sat at about 36 per 100,000, compared to Ontario, which was about 14. So Ontario as a whole also saw an increase, but we as a health unit jumped pretty drastically and sat at fourth for quite a while. Currently, we sit at fifth. And in saying that, all of our other Northern Health Unit counterparts are the other three or four higher regions in terms of opioid-related death rate. So just a really important statistic to note that this is a provincial-wide issue, but also really impacting our northern regions more so. So in recognizing that is kind of what we're seeing locally, how do we as a community address this drastic increase? We really want to look at using a comprehensive approach to addressing substance use, across the whole spectrum. So addressing substance use in Canada and in our community is really a shared responsibility that must occur between all levels of government, stakeholders, community agencies. And we really want to see this include folks like law enforcement, both provincial or municipal, depending on where we're located, medical associations, universities, colleges, public health units, harm reduction agencies, and schools. And when we come together collectively, we can develop regulations and standards, provide harm reduction, treatment, and prevention services, and implement educational programs. So the evidence really suggests that substance use needs to be approached through a variety of methods, including that prevention, treatment, harm reduction, and enforcement. Though for today's presentation, we're really going to focus on that harm reduction pillar of this spectrum. As many of you know, if you attended our last presentation, we do have a local community drug strategy, which does encompass all four of these pillars, with the addition of an Indigenous engagement pillar locally. And we're always inviting new members to the table. So if at any point in time you're interested in joining some of those conversations, and especially if after today you're interested in some of the other pillars that we didn't talk about, please feel free to reach out. I'd be happy to connect you and bring you forward to the drug strategy. So now I'm going to just pass it over to Caitlin to get a little bit deeper, do a deeper dive into harm reduction. And Caitlin, if you just want to let me know, I can click your slides for you, but just kind of let me know.
Yeah, that sounds great. Thanks so much, Sam, and thanks everyone for being here. I just wanted to sort of say before we kind of jump into harm reduction, and I know we're going to save questions till the end, but I really encourage, if folks have sort of thoughts, ideas, comments, questions about harm reduction, if you want to put them into the chat box. And I really just want to preference and say that it is a safe space. So while Samantha and I will be really focusing on harm reduction and the benefits and the good things that we see with this approach, we realize that is not always a philosophy or a view that folks have really been used to, or have been implementing it in their workplaces and the clients that they work with. We're all sort of coming to this conversation from different lens and topic areas and interests. So if folks kind of want to if they want to disagree with some of these ideas, if you want to sort of offer other suggestions and have a conversation, I do just want to let folks know, please feel free. Any and all conversation around harm reduction, pros, cons, and everything is really such an important part of this conversation as well, and really recognizing things that work and maybe things that we can sort of modify and change depending on who we're working with. And so what sort of brings us to this conversation today, a lot of the stats and the information that Samantha has already shared with the group, and recognizing that we are losing people, people are dying. So harm reduction works to reduce the adverse health, social, and economic consequences associated with substance use, whether it's both legal and illegal. Recognizing that people use drugs and substances for a variety of different reasons. That could be social, economic, really coming from that trauma-informed lens, right? A lot of the folks that we work with, that we hear stories from, that we engage with, do come from backgrounds of trauma, of abuse, neglect, abandonment, and we recognize that people use drugs and use substances for a variety of different reasons. Harm reduction is a philosophy and a practice that is evidence-based. It is non-judgmental, non-coercive, and really is client-centered. And we work to meet clients where they're at. And I can't stress that enough, and the importance of really working to engage people with where they're at in their journey, and sort of not the other way around. Doing more frontline work at the AIDS committee, I can say that that organization really works to engage with people, because they meet folks from wherever, however they're at that day, and it really does change day to day for folks, week to week, month to month. But those main focuses really stay the same: non-judgmental, respectful, encompassing, and we welcome folks in sort of no matter where they're at, and recognizing that will change day to day sometimes, and we're working to really just meet folks in that moment, to kind of provide services and do a lot of that relationship building. And that relationship building is really key when sort of encompassing harm reduction. A lot of the times, substance use is very much criminalized, it's stigmatized. People are coming to access services already feeling pretty down and out, feeling very scrutinized. So really, in providing these services, we try to patch a little bit of that and build some relationships with folks so they do feel comfortable accessing services. Next slide, please. And so the importance of harm reduction really works to reduce harm. And it's really as simple of a definition as that. We get into some of the methods and programs and services that really employ a harm reduction sort of ideology. But it really could just be as simple. We practice harm reduction every day. It could be as simple as wearing a seatbelt, putting on a hat when it's sunny, wearing a seatbelt. For the context, though, of sort of this work and why we do harm reduction, working at the health unit at the AIDS committee, recognizing that harm reduction does help reduce overdoses and deaths. It helps to reduce injection substance use in public places. It helps to reduce the number of used and discarded syringes that are being found in public spaces. It does work to reduce the number of sharing of needles and other substance use equipment. It helps to reduce crime, and it helps to reduce infectious disease. And so if I want to sort of raise my blood pressure, I will look at our local media sometimes in North Bay. So I'm situated at the North Bay office in Parry Sound, or sorry, the North Bay office. I was part of the health unit, and when I read our local media and comments sometimes, one of the biggest things I hear is that the health unit is an enabler. So because we offer harm reduction programs and services, we are telling people it is okay to use drugs. And so these programs, really work to support the person and to tell the person that you matter and your health and safety and your well-being matters regardless of your substance use. It's sort of that recognition that people will use regardless, just without programs and services that really work to help keep them safe. Their safety will not be the most apparent thing in that situation anymore. People will use syringes, reuse, they'll share, and then we will start to see the increase of things like HIV and Hep C. So that was sort of part of my older portfolio at the AIDS committee, working as part of a Hep C treatment team. So we do know that people who are sharing substance use equipment, using drugs, are at a higher risk for things like Hep C and HIV. So it's really, recognizing that people will use regardless, and working on ways to sort of support people to try to help keep them safe. Next slide, please. And so the great thing about employing harm reduction practices is that we at the health unit are in a really unique situation to build relationships with people. Same with programs and services at the AIDS committee, any organization really that employs sort of low threshold services, needle syringe programs. Um, that day to day, it might be very challenging to build trust with people. But as you continue to sort of do it in a non-judgmental way, you see that folks will start to come back day after day, access services. So what might be, somebody coming into a needle syringe program for needles, that might be the situation for months and months and months. Maybe it's that 50th visit to a needle syringe program where that person will inquire about maybe treatment or getting an HIV test or getting tested for sexually bloodborne infections. So we do really see the benefits long term of folks coming in. It helps reduce employment among people who are using substances. So one of the things that I absolutely love and adore about the work that we get to do is that we are always looking to employ and utilize people with lived and living experience to inform the work that we're doing. It's one thing for Samantha and I to say, okay, well, we think this is the issue, let's do this. But to have somebody who's living in the now in that situation or is still very connected to those communities, being able to tell us like, hey, you know what, you're doing this, but I think you should try it this way, you might have better luck. And so we will work to utilize that peer engagement component in everything that we do, and recognizing that those are the experts in the field, and we need to sort of be looking to that lived experience. It's great to have credentials behind your name and be educated in a more traditional sense, but we definitely can undermine that value that lived experience brings to the table, working really in any field, but in particular to to mental health and addictions work. Super, super important. Would definitely encourage workplace to sort of, food for thought, think about that. Are you, employing peers? Could you possibly do it down the line? And there's lots of really good literature and training programs to sort of support that. It also leads to an increase in outreach and education, referrals to programs and services, definitely long-term cost savings, and a big piece again, right? We are not enablers. We recognize that harm reduction does not encourage or increase drug use, and that people are going to use regardless. And so we're really working again, as I said, to just sort of support people where they're at in their journey, and keeping a non-judgmental lens. And we sort of get into it, right? And as service providers, excuse me, checking our own biases around substance use and sort of recognizing that sometimes abstinence is not the end goal for people, and really kind of continuing to challenge ourselves, and our ideologies as to what we think our clients should be doing, I think is definitely an important factor as well. Next slide, please. So again, harm reduction is not for or against drugs. It's not implied consent to use drugs. It's not anti-abstinence, because we definitely recognize that abstinence will work for some, and it won't work for others, right? And abstinence is definitely a really good harm reduction tool that many, many people utilize on an everyday basis. And it's also not anything goes. And I think that's a bit of a misconception as well. People will assume people who use drugs are not responsible, that they don't care about themselves or their communities, that they can sort of just come into an agency and do whatever they want. And it's definitely not the case. There are policies and procedures and safety codes of conduct at the health unit, at the AIDS committee, at other needle syringe programs. So there is definitely the same level of expectation to abide by these codes of conduct as there would be for anything else. And there are repercussions as well if folks do not sort of abide by those guidelines. I would also say though, there is sometimes some flexibility in recognizing, if somebody's come in and they're upset and they're agitated, kind of keeping those social determinants of health in mind and realizing sometimes the correlation between substance use and poverty and homelessness. Sometimes our clients are expected to come in and access services and, meet with their workers and follow this plan and go to these appointments, but are living on the street, maybe haven't had access to a hot meal in a couple of days, nowhere to shower, nowhere to take care of themselves. And so I think we sort of forget the human aspect of that as well. And recognizing, if those basic needs aren't being met, it might be very, very challenging to then go and try to access services and do everything else when you're starving, when you're hungry, yeah. So I think it's just a bit of perspective as well, and sort of keeping some of those other pieces in mind, which is a whole other, presentation topic. Our governments and our powers, the higher powers up are definitely, we definitely have some work to do for a lot of these social justice issues that are affecting definitely a lot of our community members. Next slide, please. Well, it's Sam's turn, so Sam's going to jump back in.
Thanks, Caitlin. I just wanted to highlight or start by highlighting that there are a wide range of harm reduction strategies, some of which I'm sure folks are very familiar with. So these programs and services and practices all help to minimize harms associated with substance use, but also there are other harm reduction practices that are present in kind of like our everyday life. Some examples of that are things like hard hats on construction sites, or wearing helmets when you go for a bike, PPE that we saw all across the province, and things like flu shots and seatbelts. So there are harm reduction practices that we practice day to day that are not necessarily substance use related, but of course, then the importance of having substance use harm reduction practices in place is also super important. So some examples of what harm reduction when it comes to substance use looks like are things like designated drivers or nicotine replacement therapy. So again, these are just things that are reducing the harms for people who are using different substances. Things like promoting the low risk guidelines or safe use practices, for example, for alcohol or for cannabis. These guidelines exist provincially for these for legal substances. Then there are also things such as supervised consumption sites and overdose prevention sites, where folks can go in and use their substances in a controlled environment where there is somebody who's there to watch over them just in case anything happens, and to provide an intervention in the event of an overdose. Other things include things like substitution therapies, like opioid agonist therapy, like methadone and Suboxone, those types of things, safer supply programs, and then things like community cleanups to collect needles and safer sharps disposal. So there's lots of examples of what harm reduction strategies really look like within our communities, and some are maybe really obvious and some of them are a little more subtle, but all of which are reducing the harms or minimizing harms that are associated with substance use. So one of the most predominant harm reduction services that we offer locally are needle syringe programs. And Caitlin mentioned these a little bit in one of her slides, but needle syringe programs really offer free, no cost, safer substance use equipment and disposal, always offered by kind of like welcoming, non-judgmental staff and local agencies. Individuals who use drugs can visit any needle syringe program site to obtain new equipment in order to use their drugs safely and reduce the risk of infectious disease or bacterial infection. Needle syringe programs also offer a wide variety of other services, including things like client education about safer use practices, Naloxone Kits to make sure people have the life-saving medication in case they need it, And then, of course, there's always opportunity to refer to other services for a variety of health needs, depending on what an individual is in need of. Services are always provided without judgment, and the service providers really aim to build rapport and trust with folks to make sure that if and when they need other health services, that there's that fear or stigma or anything else that might be preventing them from accessing those services can be reduced as much as possible by having a friendly, safe space to ask for that support. Needle syringe programs in our community also look at assessing and understanding local needs. So really getting a sense of what's needed within our community and how we as a community can better support those who are using substances. So making sure that we're incorporating all of these needs into program delivery across the region. The next couple slides are just kind of for folks if they're interested. I'm not going to go into detail. If you have specific questions, we'd be happy to answer, but these are just some of the equipment that is offered at needle syringe program sites. You can find more information on the Ontario Harm Reduction Distribution Program website if you're interested. But anyway, so we offer things like sterile water, acidifiers like vitamin C, filters, cookers, sometimes called spoons, different kinds of bowls, pipes, and stems, push sticks, foil, and then of course we offer syringes through our program, which is technically separate from the OHRDP, but it is offered through the health unit, distributed across all of our needle syringe program sites locally. So needle syringe program sites specifically are a very important harm reduction service. They provide safer substance use equipment, as I mentioned, to reduce bloodborne infections such as HIV, hepatitis C, hepatitis B, which could otherwise occur if folks are sharing drug use equipment. Needle syringe programs are evidence-based and cost-effective in reducing the financial costs on the healthcare system related to treating BBI or bloodborne infections. Needle syringe program services aim to reduce the harms to the health of the individual who use substances, as well as negative societal impacts and economic consequences that result in the use of substances. As I mentioned before, needle syringe programs also offer an opportunity for folks to who use sharps to return those sharps to reduce the number of sharps, so syringes, pipes, that sort of stuff that are disposed of improperly within the community. So we have lots of opportunity through our needle syringe programs sites to return any used sharps. And of course, always offering harm reduction messaging and making referrals, as I mentioned. So for folks who are looking for safer use information, we do offer that through all of our programs. One example of which is here on the left. So just something that we offer is information about how to choose a safer injection site. So that's one brochure that's available to folks, or one message that's shared widely. And just another thing I wanted to mention that comes about because, that's related to the importance of having needle syringe program sites and ensuring that people have new equipment to use when they need it. You can see here in this image on the right, a new needle versus a needle that's been used once, twice, and 6 times. So really by providing people with new equipment, we are just in that of itself reducing the risk of injury to folks, and then continuing to reduce some of those burdens on the healthcare system. All right, now I'm going to pass it back over to Caitlin to chat a bit about naloxone.
Wonderful, thanks so much, Sam. So this might be definitely a familiar term with folks now, that it's being more widely accessible, more conversation around naloxone, definitely in the wake of this opioid epidemic that we sort of find ourselves in as a province. It's sort of, been on the increase in a lot of different communities. The amount of folks who are experiencing or witnessing overdoses. So naloxone temporarily reverses the effects of an opioid overdose. So the two images that you see are the two different naloxone kits that are available. So the top image that you see is the nasal spray naloxone, and the bottom image that you see is the injectable naloxone. So when I got hired at the health unit, I was sort of informed that two of my bigger aspects of my portfolio would be looking at naloxone training and sharps training, which I will get into. So I do just sort of want to mention, if folks are interested in sort of receiving any training for naloxone, you want to know where you can access a naloxone kit, please definitely let me know and I can make sure you're well connected. It is definitely a life-saving tool that many folks are using right now, in the situations that we're sort of finding ourselves in community-wide. Naloxone is a non-addictive, non-psychoactive drug that blocks the effects of the opioid on the body, as I sort of mentioned already. You cannot misuse naloxone. You cannot, a person cannot get high off of it. They cannot become addicted to it. And it is temporary. So that's definitely a big piece to know as well. It does work very quickly in the body, usually under 5 minutes, between 2 to 3 minutes, but does wear off very quickly. So it will wear off in about 30 to 45 minutes. So that is really important when we're doing these trains with folks, to sort of let them know administering naloxone is the first step, the most important step, but calling 911, EMS, making sure that medical attention does arrive on scene as well is a very important piece, because you don't want the person to go back into an overdose, sort of depending on what substance they've taken. And so while naloxone will only work for opioid related overdoses, sometimes it can be really challenging to know what a person has taken or what the drugs have sort of been laced with or mixed with. The great news is that if you don't know what the person has overdosed on, you can administer naloxone regardless, which is really kind of a reassuring thing, right? You're not going to hurt the person. If it's not an opioid that they are on, it just won't work. You won't hurt them or make the situation worse. And it is safe to sort of use expired naloxone if that's all you have available. It is a very routine drug that has been used by EMS for over 40 years. As I mentioned, there are two versions, and we do have that training available through the health unit. There's also a map on the website as well. So if folks want to sort of know where they can access in their area, most pharmacies are providing naloxone training and giving out kits as well. But if folks want more information, you can definitely sort of let me know. And I do just sort of want to mention, we are also seeing a bit of a trend right now also with benzo use. So we're noticing that folks they have both opioids and benzos in their systems. So whether that's intentionally or unintentionally. And so when people are responding with the naloxone, the person might, start breathing again, but they might remain heavily sedated and might not actually wake up, or will wake up and be very disoriented, kind of, like maybe slobbering, and just seem really like just still really out of it, sort of. So that is sort of a trend we're hearing, we're seeing, and we're sort of working on education pieces around how to sort of navigate that situation for folks who might be encountering those situations. Next slide, please. Community sharp spin. So it's definitely another great harm reduction tool, and something that the health unit has been sort of paving the way for throughout our district. So it helps to promote health equity by providing those disposal bins 24/7. And it's a great thing to be able to offer these in community, outside traditional business hours. There is so much stigma that still exists around substance use. Even with naloxone, we've had clients tell us that they would rather die than access medical care, in a healthcare setting, because of that heavy stigma that exists around substance use. And so those are really real situations for the people, that we're talking to, learning from, working with. And so even things like sharps bins, people often don't want the stigma attached to their name to, carry around sharps containers to dispose in an office, to go in during office hours when there's lots of traffic. So these just provide really discrete options as well for folks to sort of work to reduce that stigma in community. And Samantha can speak to more where they are locally. On the right-hand side, you'll see a needle drop-off box. So there are a couple of those located in Parry Sound, or maybe just one. Sam, how many are there?
Yeah, there's just one. It's right beside the public washroom, kind of across from the IDA, or right on the corner of Seguin and James Street there.
Yeah, so it is wonderful that we were able to get one provided locally in Parry Sound as well. There's two in North Bay and also in some of our Indigenous communities throughout the district. And so again, just another tool that we can sort of use. It helps to improve community safety, protects community members. It is a reduction again in healthcare costs, and it does help to reduce stigma. And a part of this sort of education that we offer as well to folks in training is to sort of equip people with the tools and the knowledge to pick up discarded syringes in community. So to help alleviate that stigma, anyone can pick up a syringe if they find it, if they know the steps, if they're empowered to do so safely. So if folks are sort of interested in having any community sharps training, you can definitely get into contact again with me as well to sort of set something like that up. Next slide, please. And as I sort of already mentioned, those barriers that we are seeing for disposal, the stigma, the knowledge of community sharps disposal bins, and so really recognizing that we did need to have a community response, being able to provide the sharps bins, doing the education, working to empower our communities, how to handle a found sharp. So some of the literature here, these are little postcard size information packages so that you can see step 1, 2, 3, 4, really step by step, how to go through it, tips and tricks to sort of keep in mind. So these are our programs that in my role, I'm hoping to just continue to expand and build, identifying locations where there should be more sharps containers, doing some of that mapping, and continuing to put these disposal bins into community. Next slide, please. And so we are a very small group. So I'm just going to pose this question if folks want to sort of think about it and put it into the chat box. So we're just curious, what is something that you share with clients to educate them on how to keep themselves safe when using substances? So if you're having conversations with folks, what do those conversations look like? Are you aware of some of the services available that people might want to access? What are those daily interactions or encounters look like? So I'm just going to leave it there. If folks want to put some ideas into the chat box, you're more than welcome to do so. And so I'm asking the question to kind of segue into the next few slides. We are sort of nearing the end of the PowerPoint, but these next few slides are going to provide some harm reduction tips. So when we're engaging in conversation with clients or community members or peers, or we're kind of tailoring education sessions to service providers, some of the things that we sort of chat about with folks is to try our best not to use alone. So really looking at that prevention piece. Again, COVID-19 has made this challenging where, we were sort of being told to stay home, stay within your bubbles. But if you can try to fix with a friend and kind of, carry naloxone, have somebody available to respond if somebody does overdose, calling someone to let them know that you are about to use. So there is an image with a phone number coming up. So something like even an overdose prevention line where somebody can stay on the phone. If you become non-responsive, then they can dispatch EMS. You can set up calls or text check-ins, leave your door unlocked. So if EMS or somebody has to come in to respond, then they are able to. And keeping that naloxone kit and cell phone again nearby. If you recognize that you're in trouble, then you're able to sort of call somebody and get somebody to respond. I have to say, in working in my time with the AIDS committee, I am always just so amazed at how many community members we have just taking care of each other, doing those check-ins. Our folks on the ground are really our unsung heroes in this dual pandemic that we're sort of dealing with, COVID and this opioid epidemic, because um, they're the ones responding with naloxone. They're, coming into needle syringe programs and getting supplies and taking care of each other. So it is a really sort of, wonderful thing. And it is quite the opposite. People who use drugs are not irresponsible. They are quite responsible to come in and get the things they need to keep them safe. Next slide, please. So being aware of your tolerance, again, things that we would have conversations with folks if they were sort of open to having a dialogue with us and trying to encourage people to use less of their drugs when their tolerance may be lower, using smaller amounts to test your tolerance, trying to smoke, snort, or swallow your drugs instead of injecting them. Injection drug use does pose more of a risk in the sense that you get more of the substance into your bloodstream at once. Trying to encourage folks to stay hydrated and eat something before and after prolonged use. Next slide, please. Avoid mixing drugs, so trying to use one drug at a time. If you are mixing, use less of each drug. If you are using with a group of people, trying to mark equipment to identify what belongs to you as to avoid cross-contamination. Again, in a perfect world, this would be a really ideal solution, but we know because our drugs are being sort of mixed and contaminated with different things, this can sometimes be easier said than done. But again, just trying to have these conversations to get people thinking about some of these ideas. Next slide, please. Know the quality of your drugs. So again, perfect world. We know it's not always going to be the situation, but trying to know your dealer, kind of build that relationship, trying to obtain or purchase drugs for yourself if possible, versus having somebody seek something out for you just to avoid, if possible, getting unknown drugs. Using a testing kit to know what's in your drugs. That is not something that we have available locally, but other communities, larger communities do. And ask others if they have tried a particular batch. So again, in sort of working in needle syringe programs, that is a really great one as well. When you build relationship with your clients, like they're your best source of knowledge. And even at the health unit as well, even though we don't work directly with clients anymore, and kind of hearing things that come through in our needle syringe program downstairs, our clients will usually be the first ones to tell us there's a bad batch in town, watch out. Get more naloxone, let's get it out. And they're usually the first ones that can sort of tip us off, and so we can sort of work to build some messaging around that. Next slide, please. Sorry, I'm just scrolling down on my other screen to my notes. So engaging with people who use substances. So again, I've already sort of chatted about much of this, but really working to be kind, to practice compassion and empathy. One of my biggest sayings is that we're all just sort of one trauma away from being in the shoes of the people that we support. Nobody sort of wakes up one day and decides like, hey, this is what I'm gonna do. So I always try to stay humbled in the work that I do, and sort of keeping that perspective, being that safe space, being inclusive, being non-judgmental, putting the person you're supporting at the center of their own care, and acting as a support for that person and allowing them to navigate their own life choices. At the end of the day, that person knows what they need and what's best for them. So how can we sort of support that versus trying to maybe kind of dictate a scenario and what we think should happen? Definitely recognize and check your own biases around substance use and recognizing that it is definitely a really complex issue. And do not make assumptions about substance use or assume you know what is best. As a society, we have really set up a culture of what drugs are good versus what drugs are bad. You know, if I go to the liquor store at the end of the day with my toddler, I'm a mom who's had a tough day. If I go down the street to score some crack, I'm suddenly, you know, a deadbeat who doesn't deserve my child. So why do we categorize, you know, drugs? Why is one good, one's not? Tobacco's good, crack is not. So I think it's very much a societal issue and things that we sort of just have to continue sort of engaging in dialogue about and challenging sort of these ideas and creating that awareness and education. Next slide, please, and I will let Sam take it back away.
Thanks, Caitlin. So the next couple slides, I'm just going to talk briefly about some local harm reduction initiatives. I'm sure folks have seen, well, I guess I should say, I hope folks have seen some of these posters around town over the last couple of years. You'll see these are some initiatives that we as a health unit have been involved in developing. So we did a Naloxone Saves Lives campaign, really trying to promote the fact that anybody can carry and should carry naloxone in the event that they could save a life. We supported an anti-stigma campaign that just it ties in really well with what Caitlin was saying around you never know kind of who around you may be using drugs, but people who use drugs are real people and we need to be there to support them. And then we have a whole series of posters around resources that exist within the community, especially related to opioid overdoses. So for example, this one here is an overdose prevention line that exists nationally now. They've expanded quite large, but individuals can, if they are using alone or expect to be using alone, they can call into this number and have somebody stay on the phone with them while they use. And in the event that they become unresponsive, that person will call emergency services for them. So these are some local initiatives. Going hand in hand with this, the Anishinaabe Nation actually took some of the concept for the anti-stigma campaign and expanded it for use within some of their the communities that they serve, translating and updating some images. So just some really great examples of how we're able to expand some of this work across our community and what that really looks like. Okay, and then the next here, I know I saw a question in the chat box from Valerie regarding local needle syringe program sites. So you can see here, and these can also be found on the Health Unit website, as well as the Ontario Harm Reduction Network. Sorry, I forget the name of the website. I have it on the next slide here, but there is a map of services.
Ontario Harm Reduction Distribution Program.
Thank you. I knew
no worries.
I added an extra word in there.
It's multiple.
But these are our local sites that are open and available. I will say, as far as I'm aware, the First Nation Inuit Health Branch is still closed to the public, but everywhere else, folks can go in, get new harm reduction equipment, bring back any used equipment that they might have that they want to dispose of. So those are some local sites for needle syringe programs. So that's to get a new safer use equipment. And then we have a few extra sites that offer naloxone within our community. So we have here like the sites that are in East Parry Sound, the town of Parry Sound, as well as the nursing stations in West Parry Sound. So locally in the town of Parry Sound, these are the kind of 6 sites that folks can pop into, get naloxone if they need it. I will say that the emergency department is 24-hour access. So that's just a really great one to keep in mind. That folks can go get naloxone at any time of day through the emergency department. They don't have to register or anything. As far as I know, they just have to go in, talk to the desk, and the desk will get them some naloxone. I just wanted to mention that these are the local distribution sites, but folks can also go to local pharmacies and pick up naloxone at local pharmacies within town. So these sites typically the sites on the slide here typically give naloxone to those folks who are using substances at risk of an opioid overdose, or a friend or family member who are at risk of an opioid overdose. Whereas pharmacies have a little bit broader of a catchment in terms of who they can distribute naloxone to. So just to keep that in mind, both the sites and pharmacies are local services that provide naloxone. Then finally, I just wanted to share a couple of additional resources for folks. So you can find more information about harm reduction on the Ontario Harm Reduction Network. The CADI website is a really great website to check out if you're interested in learning more. They've got so many great resources to download. As I mentioned, needle syringe program, there's a map on the Ontario Harm Reduction Distribution Program website. Of course, locally, the AIDS Committee and the Health Unit are always here to support folks, as well as the Prairie Sound Drug Strategy, which I mentioned. And then there's some local resources, but additional resources that you can direct your clients or anybody to, or yourselves if you're interested in more information about local services. So Connects Ontario will connect you to local mental health and addiction services, the overdose prevention line that I mentioned, as well as there's an app. If you go to any of your app stores, it's called the Brave app, where it's really similar to the overdose prevention line. It just is an app on your phone, where if you're using alone, you can activate this app that will alert your care providers or your what's the word I'm looking for? Your emergency contacts in the event that you become unresponsive. So just some additional resources to check out. And then coming to the end here, I'm just gonna pass it off to Caitlin to wrap it up for us.
Yeah, so this is a message that we just sort of wanted to leave as our concluding slide. So before Samantha joined the health unit, I was sitting on the Parry Sound Drug Strategy from the AIDS Committee. And so we in Parry Sound at that time had put together a PSA. So two of my former colleagues at the AIDS Committee are in the video, which is the link is attached at the bottom. So it was really just a tool to sort of think about ways as service providers, healthcare providers, that we can do a bit of that stigma reduction and sort of keep a bit of perspective when we're working with clients. And so just a little snippet from this, if folks want to see the video, it is really quite wonderful. Again, can be found on the health unit website, and it's very, very short. So if you're even doing any like internal training, having conversations with folks, they're great little clips. But healthcare and service providers can be the first point of contact for individuals who use substances, and it is important to remember that there can be negative implications from drug-related stigma that can affect whether an individual seeks help in the future. Anticipation of mistreatment, distrust, stereotypes, assumptions, and self-worth. So it's definitely just a way to sort of bring everything that we've chatted about in the last hour into perspective, and realizing that, you know, these communities can be very hard to build trust with, to provide services to, but sort of by keeping, you know, some of that stigma reduction in mind, checking our biases, asking questions, engaging in dialogue with clients, asking them what they want, hearing what they have to say, and working to really build and create those relationships can definitely go a long way, and really does make a difference as to whether or not somebody will continue to reach out or not. So we do really commend everyone for being here today, for being open to hearing our presentation on harm reduction. And yeah, if there's anything we can sort of assist with further around stigma, naloxone, harm reduction, sharps, any or all of the above, we'd be happy to do so. So thank you so much, folks. Are there any questions, comments? It's a lot of information all at once.
I have one question, and it may be a bit silly, but what are acidifiers used for?
And Sam's just sort of scrolling back to the visual for folks.
Sorry, and I was on mute there. So acidifiers such as vitamin C, so if somebody's using a drug that's insoluble, like certain heroines or crack cocaine, and they want to dissolve it in water, just the acidifier or the vitamin C helps to dissolve it so that it becomes easier to inject.
Thank you.
No problem.
No silly questions. I don't believe there's any such a thing.
Any other questions from anybody?
I had one. So I'm at Mary Street Center downtown as well, St. James United Church, and we have both an injectable and nasal spray Naloxone kits. How long are they good for? I think we've had the injectable one for the whole of the pandemic. So is it still good?
Yeah, there's expiry dates actually on the back of your kit. So can folks see me, or can you just see the PowerPoint?
Oh,
Are you able to just
I
stop
can see you.
Oh, okay. Yeah, wonderful. So, oh wait, but you know what? My background. Let me just take that off so you can actually see me. Yeah, so your naloxone kit would be here, and then on the back of the naloxone kit is where you'll see your expiry date. So they usually have a shelf life of about two years.
Okay.
So if you just got it before the pandemic, you're likely okay. But yeah, it definitely doesn't hurt to just check. And in a pinch, you definitely could still use expired naloxone. But yeah, if you're noticing it's getting close, then you could definitely just pick up a new kit.
Very good. And the other question I have is, so we have multiple users in our building, and I would love to be able to offer, like for our church council and people that are leading groups and whatnot, to have a couple of training days just to be able to show them like exactly how to do it. I myself know how to do it, but if I'm not in the building, it would be nice if our renters and other people could do that. So I know, Samantha, we're having a meeting soon, so maybe we could talk about it then. But
Yeah, for sure. And we can we can chat when I come to you in a couple weeks, but depending on like if you think in person or virtual would work, like either Caitlin or myself could totally provide some training. Typically, what do we usually schedule, Caitlin? Like 2-ish hours? Depends on the size of the group, maybe a little bit less.
For naloxone, you mean? Sorry? Yeah, it's about an hour and a half to 2 hours, just sort of depending. Yeah, you got it right.
Yeah, so I'd be happy to chat further with you about that, Monica, and we can kind of figure out what your needs are, how many people you think would be interested, and I can look at mine and Caitlin's schedule, and we can try to start something out for you.
yeah, I was thinking maybe even in September or something like that, when things get going again. I mean, we have the youth, the drop that happens, that they might like to do it separately. So yeah, we'll talk about it. Thanks.
Okay, cool. And something else I just thought of was for International Overdose Awareness Day, something that we had been talking about for North Bay was doing kind of on the day of doing some naloxone training. So I can look into that to see if maybe we could even incorporate that somehow into our day for that, but we can chat more about that when we meet about that day.
Mm-hmm.
But thank you for your questions, and I think that's great.
Hello.
Hi, Valerie.
I just want to make a comment, and a lot of it has to do around with the stigma. I work at West Prairie Sound Health Center, and I've had the experience of working in Emerge. And I want to say our Emerge department is so empathetic to the needs of those with drug and alcohol overdoses and coming in. Is once they come to the medical floor, there is not a whole lot of empathy, and it's whenever they're, looking for some pain medication or something, there's a lot of a negative feedback in there to say, oh, they're just looking for a high. I know we have a surge learning program that maybe I think, well, because Kathy is with Kathy Hamer with OTN and all that stuff, that I'd like to approach that to get the surge learning to give some education to those who think that way, because we need to be grateful that we don't have that brain. Because like I was mentioned earlier, I believe with Samantha, said that, because our something traumatic could happen to us and we could just be in their shoes. And what kind of help would we want? We want to be listened to and feel valued. We just want love.
Yeah.
I think education is even with the healthcare workers, which is very unfortunate. That's all.
Yeah, thank you so much for that comment, Valerie. It's so true. I mean, we all sort of have work to do and learning to do, right? And having sort of advocates like yourself to sort of make training sessions like that happen, or to at least put it out there and see, like, I think that would be wonderful. And I'm sure it's certainly something we could help assist with if you're interested. Because doing more frontline stuff too, like in my previous role, it is heartbreaking to hear somebody say to you, like, I would rather die than go to the hospital. And that's not a unique thing to North Bay. That's a societal thing again, right? And we hear it in other communities in different capacities. I've had clients come in with like abscesses that they've wanted to drain themselves because they don't want to go to our hospital. Oh, I'll go if I'm going to lose a limb. If I'm going to lose a whole leg, a whole arm, I'll go. If I'm going to lose a finger, I don't care. I'm not going. And that's heartbreaking. I would be very sad to lose a finger, right? And some of our folks just that's their alternative, just from countless experiences. So yeah, any opportunity we have to educate and to have open conversations with folks, we would welcome the opportunity to do so.
And I will just also add in that we, as a team at the health unit, have been talking about doing a bit more with stigma related work. So as we move forward with some of that work, the health center is definitely going to be somebody that we're going to engage. And so I think like maybe looping back with yourself or like through Kathy, however that might work, it might be a really great opportunity for a partnership to do some of that work. So I would be happy to kind of keep folks in the loop if there's interest, and if like when we get to a place where we're ready to have some of those conversations and build some of those partnerships and do some of that work within the healthcare system.
And I agree, Valerie. I think it's a very valid point that you've made. I'm just not sure that the Surge program that we use is the most appropriate. We may have to go through Millie Thompson, our educator here. Any other questions from anybody? Hearing nothing, I'd like to thank you both very much for presenting on this topic. I know I certainly learned a lot. I didn't know much about harm reduction other than, the basics that we learn in school. So thank you very much for coming once again and presenting.
Thank you so much for having us.
Thank you.
Great discussion and great questions, everybody.
Thank you so much.
Have a great afternoon.
You as well.
Thank you. Take care, everyone.
Thank you. I love that brave. I never knew about that.
Yeah, another tool for our toolbox.